Welcome to Quality Time, a Houston Methodist leading medicine podcast. I'm your host, Dr. Schaal, a clinician scientist and a retina specialist, and I serve as the Chief Physician Executive of Houston Methodist, located in the world-renowned Texas Medical Center. I passionately believe that quality is the heart of healthcare, and a commitment to quality is essential for every healthcare system. Join us each month as we discuss the latest advancement in quality in healthcare with clinicians, researchers, physicians, industry experts, and thought leaders who are as passionate as I am. I'm delighted to welcome a very special guest today, Dr. Marc Boom. Dr. Boom is president and CEO of Houston Methodist, an independent academic medical center with over 2,600 beds and over 32,000 employees. The system also includes a world-renowned research institute, 7 soon-to-be 8 community hospitals, a large physician organization, and more than 50 graduate medical education programs. He was recently named the 2025 chair-elect of the American Hospital Association, also known as AHA. This is the national organization representing and serving over 5,000 hospitals and providers committed to improving healthcare. He will become the chair of AHA in 2026. Welcome, Dr. Boom. Most importantly, we haven't said you are my boss.
And it's a pleasure to be here and great to work with you, Shlomit.
So tell me a little bit about your career.
You know, I've been blessed to work at really one institution most of my career. So I've been at Houston Methodist for 27 years now. Before that, I was an undergrad at UT and went to Baylor College of Medicine, trained at Mass General in internal medicine for 3 years. Kind of got interested in the business side of things. So I went to Wharton and the University of Pennsylvania, got an MBA, did some general medicine and geriatric medicine training there, and then found my way back to Houston. And I've had the privilege of serving all the way from, kind of 50-50 clinical and a small physician organization we were building to a small hospital to eventually running our main flagship hospital to now almost 13 years or about 13 years as CEO of our system.
Fantastic. And you're obviously a very inspirational leader, but something that I noticed about you is that you really emphasize safety, quality, service, and innovation. Tell us a little bit of how this came about. How did you emphasize safety and quality first?
Well, I'm a physician, right? So why'd I go into healthcare? I went into healthcare to help people, and you're never going to help people unless you have the utmost safety and quality. So that was the appeal to being, to getting the business side of things was actually to impact people more than one at a time. So really, as I became head of our flagship hospital, it's when I really began to have a lot of impact over the system, and we really just seized the sort of quality and safety ring as our big focus. And then, of course, becoming CEO of the system, was able to really craft a vision for our second century that featured safety and quality first and foremost.
So when you talk about quality, how did we do? I mean, when you took over, we were not as good as we are today. So tell me a little bit about that journey and how did you motivate people to really move forward?
We were really involved with what was called University Health System Consortium at the time, now Vizient. They've, kind of folded up into Vizient over time. I actually kind of a little bit following that ended up on their board. And I think they have the best balanced scorecard that we can use in healthcare. And I'm a big believer that when you focus on the fundamentals, all the accolades follow, and really, most importantly, great things follow for our patients. In around about 2005, I'd just taken over the main hospital. One other people comes to me and says, "Hey, we've been putting together this, database of normalized, standardized data across all these institutions, and we've kind of been studying what makes great institutions great. And we've pulled some data, and we've got 3 institutions that are top of the heap, and we got 3 institutions that are kind of middle. And we won't tell you which one you are, but you're one of those 6, and we'd like to come study you." And quite frankly, I had no illusions. I knew we were going to be one of the middle ones at that point, knowing where we'd been. And I said yes to use it as a lightning rod. And they came, they studied us, they published, and we were able to sit there and say, "Okay, guys, we're 49th right now. That's not where we are supposed to be." And it
this was
became
in 2005?
2005, 2006. Yeah.
Okay.
And that became really a rallying cry for us to say, this is a competitive place. I'm a competitive leader. I think when we compete on safety, quality, service, our patients are the winners. And so we really set about changing that.
So now we have a great opportunity to brag a little bit about our own achievements here at Houston Methodist in 2024. Tell us a little bit, how did we fare in 2024?
Yeah, we set about, as I said, really changing that. And over time, Vizient has got both an academic medical center ranking, but also now all of our affiliated hospitals for about the last 9 years. And we've just had phenomenal performance. I'm so proud of each of our institutions. Our flagship academic medical center hospital, Houston Methodist Hospital, competes with big name places in the country. There's 115 of those. We were ranked number 4. So we're very excited about that. Actually, our first top 5 finish, we've been reliably in their 5-star group for quite a few years. They have a next category down called large specialized complex care medical centers. We have a couple hospitals that bounce in and out of that from a size perspective. This year, Houston Methodist Willowbrook is their number 2 out of 177 hospitals.
Amazing.
And then the one that's really amazing, what they call their complex care medical centers, there's 204 in that group. We ranked number 1, number 2, number 3, and number 4. Last year, we were 1, 2, 3, 4, and 5, but one of those is now Willowbrook, which is up in that higher. So 2 years in a row, we're sweeping the top of that. And then in their small community hospital, we only have 1, and they're ranked 14th out of 364. All of those are 5-star Bernard Birnbaum winners at Vizient. I'm just very proud of the teams that make that happen.
Yes, I couldn't be prouder of our teams. I know a lot of work is really necessary to get to that ranking and also this consistency. I don't know about many healthcare systems that have all their hospitals as top performers. How did we achieve that? What's the secret?
Well, we've not seen anybody with that level of consistency. There's some systems I admire greatly that'll have several hospitals on the list as well, but none have had that broad-based, very consistent year after year and, really top of the rankings. It really comes down to some of the things we've already been talking about. I mean, first and foremost, really having that unified vision. So our unified vision is unparalleled safety, quality, service, and innovation. 6 simple words. Unpack those a little bit. Unparalleled means nobody is going to be better. We are going to be the best. It also means we're never going to be satisfied with where we were yesterday, right? So we continually improve. We always look in the mirror, say, where are we not unparalleled? And we say, we're going to fix that. And then they're in order very purposely. So safety always comes first. So we're messaging very strongly to our team that, whatever happens, we want to give people everything they can get. But sometimes you have to make a little bit of a choice. Safety is always going to be our first and foremost, and of course, quality right after that. But we talk about service and making sure a compassionate, faith-based, attending to the holistic aspects of care for our patients, as well as being one of the most innovative places, whether you're talking about traditional clinical innovation and the research we do, and you're talking about digital innovation, increasingly where we really are at the forefront.
So you talked about 6 simple words, and one of these words is "and." Tell us a little bit. I've heard you speak at really inspirational talks about the sacred "and." What does that mean?
Yeah, I got to say, I used to think of it as 5 words for quite a long time. "And" just was necessary, right? Grammatically, to have it there at the end of the phrase. And about 8, 9 years into my tenure, realized we had it wrong. We needed that "and" in there. So it's a very complex set of answers, but I'm gonna give you a simple one and we can unpack that a little bit more if you'd like. But at the end of the day, if you think about our patients, they're not asking us, hey, I want it to be really high quality and safe, but it's okay if it's not this. They want and demand and deserve every bit of that. So it's really a leadership philosophy and mindset that says we can achieve it all. Yes, we'll have to make some choices. Yes, we're gonna have to do some difficult things. Sometimes I'm going to turn to you and I'm going to say, hey, you need to meet budget and you need to be the safest, highest quality place. And they look at me, and say, well, that's a choice. And you say, no, it's not. And it is something that when we have the kind of art of leadership, we can make sure happens for people.
So I know you invest a lot in the culture of Houston Methodist. What it is, and tell me how you do that here, how you lead, 32,000 employees to really concentrate on those 6 words?
Well, if I had to say one of the things I'm proudest of, so I've been CEO for 13 years now. And in that time, I think there's no doubt, and this predates me, so I'm not taking all the credit because I would say for really a quarter of a century now, our culture has gotten stronger and stronger and stronger and stronger. But just to give you a little bit of a feel for that, in 2012, when I became CEO, we had 14,000 employees. Now we have 32,000 and counting. Uh, in that time, our culture's gotten stronger. That's really hard to do. And that doesn't happen accidentally. And so the really, really key piece about culture is it has to be intentional and purposeful. So you have to work really, really, really hard at making sure you get the culture you want. And so that's something we do. And I would say it occupies probably 10, 15, 20% of my bandwidth is ultimately our culture. That may be working together with the team on some of the programs we do to reinforce it. It may be all the messaging. It may be the letters I write to our employees, the videos we do with our employees, how you act when you're out in the field, so to speak, and out and about in our institutions. You cannot achieve wonderful results without a wonderful culture and aligning people in the institution.
Dr. Boom, you had an amazing impact on this organization, and now you're going to become the AHA's president. Can you spread that culture across all America?
Working in healthcare is a tremendous privilege. I mean, we get to be we're let into people's lives. We help people. Everything we do, indirectly, directly, every person who works within our institution knows they're coming here at the end of the day to help somebody, and that's a tremendous privilege. And r- when we can connect people to the passion and purpose of why they're here, magic happens for our patients, and that can happen in any field. But of course, we're privileged in healthcare to be able to do that. And it's just a great benefit of what we have. Um, I firmly, firmly believe, you've already heard this, that if you don't get culture right, you can't get the rest right. So if you do get it right, the magic can happen. So it takes up a huge part of our activities, my senior leadership team's activities. I would urge any leader in any profession, but most certainly the hospital profession, the healthcare profession, to focus on that first and foremost. So where I think there can be great impact across many, many institutions is really that mindset as leaders. Yes, I need to know finance. Yes, I need to make tough financial decisions. Yes, we need to focus on quality directly and do that, but we can't do that well until we get the people part right. And I feel a great responsibility to make this a great place for people to work. They want to come here, they want to stay here, they want to retire from here, and they love their jobs. They love what they do because that shines through for our patients. So, to the extent we can help others do that across the country in the hospital profession and beyond, I think that'd be great.
So you told me a little bit of a story before about NASA and how they motivated their first mission. Do you want to? It has a Texas root, so
Yeah, nice Houston roots. Of course, Houston, we all talk about, first word spoken from the moon, right? But famously, John F. Kennedy came and gave one of his very important speech here. But also when he was giving, which was, "We're going to put a man on the moon," right? Was how he phrased it at the time. Um, and went and toured NASA. And there's a famous story about him touring NASA and seeing one of the people cleaning up and asking that individual, "What's your job here?" And the person looked at him and said, "To put a man on the moon." And, that's when you have aligned vision, right? And that person was critically important. Sure, that individual it wasn't doing the aerospace engineering to figure things out, but those aerospace engineers and everybody else couldn't do that if you didn't have NASA safe, clean, functional place to work. Think about a hospital system. Think how critically important every person who works here. One of the things I love to do is when the new residents are here, I'll tell them a few stories. And one of the pieces of advice I always give them is to listen to every single team member because they contribute. In fact, at that point, and tell the medical students too, you have a little more time. Sometimes you're here all the time, and spend some time finding out what makes them tick, how they work, the details of their job. And I love to tell them a couple stories we know about housekeepers, right? Who would go in, they see the patient day after day, they chit chat. I mean, we work with people who select people, they train people who are really friendly, really nice, and they're talking to the patient, right? And day 4, they go in and the patient's just not quite the same. And they come out and they go to the nurse and say, I was in there with Mrs. So and so, and something's wrong. She just doesn't seem the same. She didn't get, and that nurse goes in and that nurse realizes there's a clinical issue happening and taking care of them. And I tell them, listen to everybody. Everybody's part of the team. Everybody's part of safety and quality.
Yeah, so really, quality is a game of teams. You cannot do it individually. You can be the best surgeon in the world, but if you don't have the team to support you and to make sure that the patient is taken care of from all aspects, then you don't deliver high quality, and that includes the people who answer the phone, make an appointment, and the people who follow up and schedule in timely manner, and the quality of care that we deliver. And then we talk about a little bit about also experience in the hospital. That is part of quality. You mentioned the learners. What is an independent academic medical center? I'm not sure that all our listeners know what you mean when you say that.
Yeah,
What is
we're
it?
we're a really unique structure. I think it's a very effective structure. There's obviously many other effective structures out there, but I'm biased. I think ours is probably one of the best structures, able to be nimble, to move quickly. As an independent academic medical center, we don't have either the traditional sort of ownership where both the medical school and the hospital system are owned together, oftentimes part of a university, or the other very traditional model where you may have side by side partners of a hospital system and a medical school, and all the lines get really blurry of where one starts, where the next starts. Those are traditional models. Ours is really unified governance, unified decision making, unified leadership team across all three missions. We have some important and very important academic partners, but being independent means we actually work with more than one partner, and we can therefore find things that align best with each of our partners, both for Houston Methodist and our patients, and for our partners and their institutions and their priorities. So, for example, Weill Cornell is our, Weill Medical College, Weill Cornell is our primary affiliate. They do all of our faculty appointments. We do a lot of research activities with them. They've helped start up our research institute, our GME programs, other things like that. Great, great, now 20-year long affiliation, many, many more years to come, I know. And we work really closely with them. But they're in New York City. It works really well for all those things. In fact, in this day and age, obviously, people ask sometimes, how's it work? I said, well, we do everything virtually in life now. It's no problem. We can do this really well with them. And it's outstanding. But they're never going to send us reams of medical students, for example. We do get some down here. They have great rotations, but they're a fairly small class size to begin with, and you're not going to get tons of them. So we work with Texas A&M, and with Texas A&M, we built a very innovative new subset of their medical school right now, called NMed, standing for Engineering Medicine. We've now graduated 2 classes, and have a full cohort of about 50 students a year, so 200 at any given time. These young men and women who are just incredible, they come with engineering backgrounds in undergraduate, pre-med engineering, computer science, and they come to us and they finish with a master's of science in engineering and an MD in the 4 years. And let me tell you, they are going out and going to wonderful residency programs now. Obviously, the most tenured of those are second year residents right now,
Wow.
given the timing of this new program, and so that's very exciting. A third partner is Rice University, right next door to us. Right, they don't have a medical school, but they're incredibly strong in engineering. They're incredibly strong in science. Business school is incredibly strong. So there's a lot of activities there that we're doing with them. We do work around human performance with their athletes and with our orthopedists. We do work around neuroscience, really the stuff of science fiction, right? Brain computer interface and all the different exciting things there, and many more things to come. We're working on digital health and digital innovation with them, and so we have wonderful partners. And then being in the Texas Medical Center, we get to work with other great institutions like Baylor College of Medicine, like University of Texas Medical Branch, like MD Anderson. And what we tell people is when we collaborate on education and research, our patients win. And so we ask people to collaborate heavily.
Yes, I think now that quality comes into curriculum of medical students and residencies, we really have an opportunity to contribute and to show them how it happens here in real life because, as we mentioned, we are leading in the nation in terms of quality and patient safety. I wanted to ask you something that I ask all my guests here. This is really how we like to end our interview is what does quality mean to you?
Quality is everything in healthcare. I mean, it means the real reason we're here. Every patient is somebody's mother, somebody's father, somebody's sister, brother, uncle, aunt, child. Everybody should have the experience that you want your parents to have if they came to us, or I want my parents or my wife to have when they come to Houston Methodist. And so we owe them everything in terms of service, in terms of quality, in terms of the safety, and making sure we're always at innovation. Quality is really the umbrella for all of that, because when you ask people, what do you want? Everybody wants to have the perfect knee replacement. Everybody wants to know that if they have a dreaded diagnosis, they're going to have the best possible care they can have, and have it in a loving, warm, spiritual environment where they know that people are going to care for the whole person. And that's, to me, what it means.
Wonderful. You're always inspiring. Thank you for being our guest today.
It's my pleasure. Thank you for having me.
And thank you for listening. Quality Time is part of Houston Methodist Leading Medicine series of physician-led podcasts. So that you never miss an episode, subscribe to Quality Time. New episodes will download to your podcast device. If you enjoyed our conversation today, please consider rating this episode and sharing it with your colleagues. I appreciate your support. Thank you, and until next time, I am always listening.